There's so many facets to Community Oncology Alliance that are valuable. The educational experience to bring us up to date and have an informal situation where we can ask questions of people doing the research is incredibly valuable, and COA helps us do that. We are also small businesses. We also have to understand what the payment systems and value-based care will mean in our own individual markets. We have to know what Congress plans for us, because healthcare is so much of the economy that there's no way they're just going to ignore us and let us do our own thing. So we need someone saying, what do these regulations mean for the people out in the trenches taking care of patients?
COA has helped my practice in innumerable ways. You can start on the macro level on what we've done legislatively with, PBM reform that we're working on almost daily, to taking the sequester back.
Yes, Community Oncology Alliance helps represent our practice at a national level through policy advocacy. They also help our practice administrators through the CAN network, keeping them up to date with new changes, new regulations, new ideas, new mandates to help facilitate running our clinics. They help our patients through CPAN, providing them education, helping them understand what policies are influencing their healthcare, helping them understand how they can mobilize to influence their elected officials to help improve cancer care. They help our pharmacists through COPA by helping them network and understand how we can work together with improved contracting and improve the quality and value of the pharmaceutical care that we do provide our patients.
I think everybody's trying to do the right thing, the insurers, the employers, but everybody has their knowledge in silos, and I think COA allows that information to flow between the silos. We all have the same alphabets, but we're speaking different languages. And I think COA kind of ties us all together and makes us understand each other.
There's no other organization that's like COA. It's created this sort of family. People tend to think of this as being a connector point and a source of support and guidance.
5 years ago, at my first COA meeting, I remember walking into the reception area and just seeing so many people there. And my goal there was really to become a better administrator and see what other administrators, other practices were doing. People in COA don't feel like they have these are all the right answers and that these are things that you have to do. There's a sense of community that learns from its mistakes and is an open community. So that's how you become better at the end of the day, is that you know what you're doing right now may work for now, but tomorrow may be a better way.
There's one thing I would tell other community oncology practices: they don't know what they don't know, because they could be so much more effective in their community in staying independent. That independent physician group is gone the way of the dodo bird. We are going to be dinosaurs if we don't continue to fight for the independent practices, and we cannot afford for the community oncology practices to disappear. And if they're going to stay and be effective, they need to learn how to be more effective, and they do need to join COA.